Everybody. We're going to talk about the cardiovascular system today. And I'll ask you guys the same question I ask every class. What good is the cardiovascular system? I want you to think about it. Why do we need a heart, arteries, veins, and blood? What does this do to benefit our normal functioning, our normal human physiology? So I'll let you think about that for a minute. And the answer is it provides oxygen and nutrients to metabolically active tissue, and it also disposes of waste products, and it is important in thermal regulation, and it is important in pH homeostasis and fluid balance, just to name a few of the important functions of blood. If you think back to early evolution, we started out as a single-celled creature, and we swam in our nutrient mixture, and we excreted waste directly across the cell membrane, and life was relatively simple. But as we developed into a more complicated multicellular organism, you had cells that were a great distance removed from the gastrointestinal tract and the respiratory tract. And so we had to develop a system to deliver food and oxygen to them to keep them alive. And that same system removes waste products in order to maintain homeostasis. So the evolution of the cardiovascular system was a huge step forward. It transports nutrients and oxygens to cells in the body while carbon dioxide and waste products of the cell's metabolism are removed. It also contains a pump that allows this fluid, blood, to circulate around the entire body in order to perform this task efficiently. So we're going to ID the structure and functions of the cardiovascular system and trace the blood flow through the vessels in the heart chambers and explain the coronary circulation of the heart and describe the contraction of the heart and the conduction system, and will differentiate between arteries, veins, and capillaries, list the major components of blood and their functions, and discuss the importance of blood typing and blood clotting, and describe cardiovascular disease. So the major components are the heart, the blood, and the vessels that carry the blood. Arteries carry blood away from the heart, and they branch into smaller vessels called arterioles, which eventually become the smallest vessels called capillaries. And this is where the nutrient and the gas exchange actually takes place in metabolically active tissue. This is also where waste pickup occurs, and so the blood picks up CO2 and waste products like urea and returns them back to the heart. As a result, the blood changes its color from a bright red to a dark red, which appears blue inside the veins. And the blood will eventually return to the right atria of the heart, where it will be pumped to the right ventricle. From there, it'll be pumped through the pulmonary trunk back to the lungs. And then once we reach the lungs, we will pick up oxygen, release CO2, and then the oxygenated blood will return to the left side of the heart in the left atria. From there, we'll go to the left ventricle, and from the left ventricle, we will go through the aortic semilunar valve and to the rest of the body. So that's the whole trip. But remember, arteries carry blood away from the heart, and veins drain blood back to the heart. Now, because of this, the pressure inside arteries is much greater than that in veins, and so they tend to have thicker walls, more smooth muscle, and they don't have valves. Veins, on the other hand, since they generally contain blood under extremely low pressure, need a little bit of help in order to move the blood through the body, and this is where the one-way valves come into play. They're essentially a series of flaps of tissue that allow the blood to be squeezed in a series of steps back to the right side of the heart so it can be returned to the lungs and reoxygenated. And without these valves, we wouldn't be able to generate sufficient pressure in the venous circulation to get this blood back to the heart and perform this task. And this is just an overview of the circulatory system, and so let's sort of take a walk through the entire system. We'll start at the level of the cells, which are in your body performing their important tasks, and as they do that, they have to get oxygen in order to generate enough ATP from the food that they consume to keep life going. And so this is the major reason that we have to deliver oxygen to cells in a relatively rapid fashion so they can engage in cellular respiration, which requires the use of molecular oxygen in order to generate the requisite 38 ATP per molecule of glucose, and that's sufficient to run all the body's processes. These waste products are dumped into the blood across the cell membrane and through the capillary walls, and the blood then changes color from a bright red to a dark red, which appears blue inside the veins. And then this deoxygenated nutrient-poor blood will return through the action of the skeletal muscle pump, which is you moving around, in addition to the fact that you're breathing, which has a little draw on the blood that's in the venous circulation. And eventually, we make our way back to the right atria of the heart, which is a small upper chamber. When this chamber is full, it will squeeze. It will send blood through a special valve called the tricuspid valve into the right ventricle. Right ventricle will then squeeze, and the tricuspid valve will slap shut so the blood doesn't wash back into the atria. And it'll force blood through the pulmonary semilunar valve and to the left and right lungs. And you can see here that the left and right lungs are a little different from each other. The left lung has 2 lobes, the right lung has 3, and the left lung has a notch because of the heart, which takes up some side on the left side of the body. But once we're in the lungs, the blood is able to pick up oxygen from the air that we breathe, and it'll then return it to the left side of the heart. So once oxygenation is complete, we return to the heart through the pulmonary veins. Now notice here that the pulmonary veins are red. In the pulmonary circulation, which is circulation between the heart and the lungs, the arteries carry deoxygenated blood while the veins carry oxygenated blood. And as we're going to find out in just a moment, on the left side of the heart, the systemic circulation reverses that. The arteries carry oxygenated blood and the veins carry deoxygenated blood. So very important to make that distinction and to understand that the difference between arteries and veins is not the oxygen content of the blood they carry, but the direction of flow. And remember that arteries move away from the heart and veins bring blood back to the heart. Now once we return to the left atrium will squeeze and send blood through the bicuspid or mitral valve to the left ventricle. Once this occurs, the left ventricle will squeeze, the mitral valve will slap shut. At the same time, blood will emerge through the aortic semilunar valve into the aorta, and from there it will be pumped to the rest of the body. As a result, the left ventricle of the heart is the most powerful chamber, has the thickest walls, and the reason for this is that it does the most work. So it's not surprising when you look at a coronal section of the heart that the left ventricle is by far the most powerful chamber. And then once we do that, we send oxygenated nutrient-rich blood to the rest of the body, and this allows cells that are engaged in anabolic and catabolic activity to perform their task normally. So, let's look at the heart. It's about the size of your fist, and it's located in the center of your chest behind your sternum and anterior to your vertebral column and medial to your left and right lung. The base is proximal to your head while the apex is distal, and although it's a single organ, it's easy to understand if you think of it as 2 pumps that work side by side. The right side collects blood from the body and sends it to the lungs, and the left side collects blood from the lungs and sends it to the rest of the body. There are 4 chambers in the heart. The 2 upper chambers are called the atria, and they receive blood, and they're relatively weak. They work with gravity in order to perform their task, and they're divided by a septum. The wall between the smaller chambers is called the intraatrial septum. The wall between the 2 larger chambers is called the interventricular septum, and those are the lower chambers of the heart. And they're also called the discharging chambers because when they squeeze, they send blood out through the great vessels. In the case of the right ventricle, we send blood out to the pulmonary trunk. In the case of the left ventricle, we send blood through the aortic semilunar valve through the aorta. And so the pulmonary circulation doesn't have nearly as high pressure in it because the distance between the heart and the lungs is very short, whereas in the systemic circulation the pressure is much, much higher. And so this is just a diagram showing you the blood flow through the heart. You can see here, these are the superior inferior vena cava, and this is the right atria. This is the tricuspid valve. You can see the blood flows from the right atria to the right ventricle, and then when the right ventricle squeezes, the tricuspid valve will shut, the pulmonary semilunar valve will open, and then blood will enter the pulmonary trunk and will head out to the lungs. Notice that it's deoxygenated at this point. Once in the lungs, it'll pick up oxygen from the oxygen in the air that we breathe. The color will change from a dark red to a bright red, and it'll return back to the left atria of the heart in the pulmonary veins. You can see the pulmonary veins here and here. Once we're in the left atria of the heart will squeeze. The atria will then dump blood from the left atria into the left ventricle. The left ventricle and the valve that is between the two is called the bicuspid or mitral valve, as we previously described. And then when the left ventricle squeezes, the mitral valve will slap shut, the aortic semilunar valve will open, and the blood will then leave the heart, enter the aorta, and from there go to the rest of the body. The right atrium is the collecting chamber where the blood is returned to the heart after the trip around the body, and the two large veins that return blood to the right atria are the superior and the inferior vena cava. Blood travels from the right atrium through a one-way AV valve called the tricuspid valve, and then from there into the right ventricle. And so what I'd like to do now is take a quick peek at a heart chambers video.
The heart is a hollow muscular organ, cone-shaped and roughly the size of a fist. It is located in the chest, behind the sternum, and between the lungs. The heart sits slightly off-center. The heart consists of 4 hollow chambers. The 2 upper chambers are called atria, and the 2 lower chambers are the ventricles. The right atrium receives blood from distal parts of the body by way of the superior or inferior vena cava. To keep all the blood flowing in the same direction, the heart has a system of one-way valves. All of the valves consist of leaflets that open and close in response to changing pressures within the chambers. Then blood passes through the tricuspid valve to the right ventricle. The right ventricle pumps the blood out of the pulmonic valve to the pulmonary artery and on to the lungs for a new supply of oxygen. Oxygenated blood returns via the pulmonary vein to the left atrium, and from the left atrium it passes through the mitral valve and into the left ventricle. When the left ventricle contracts, the oxygenated blood is ejected through the aortic valve to the aorta and distal body tissues. The walls of the left ventricle are 3 times thicker than those of the right side because it takes more pressure to reach distal parts of the body. The septum effectively divides the heart into right and left sides to form 2 separate pumps. The 2 pumps of the right and left heart function in close syncopation. This is a closed system, so the blood continues to pump and flow in a continuous cycle.
So when the right ventricle is full of blood, the heart will contract. The tricuspid valve prevents backflow of the blood into the right atrium, so blood flows through the pulmonary semilunar valve to the pulmonary arteries. This is true for all the blood flow through the heart. It's all one way, and it's all due to the fact that these valves only open in one direction. You cannot open the valve into the previous chamber, the previous open vessel, without a valve defect being the cause. This is very important that these valves work properly. Occasionally they don't work properly, and when that occurs, you have to replace the valve with a prosthetic, and they have varying degrees of success. The right pulmonary artery goes to the right lung, the left pulmonary artery goes to the left lung, and the vessels get smaller and smaller as we leave the heart, and eventually they end in capillaries around each air sac, and these air sacs are called alveoli. Blood then returns to the heart through the left and right pulmonary veins, at which point it's picked up oxygen and it's ready now to be pumped by the left side of the heart to the rest of the body. And this is just showing you the functioning heart and the valves that allow this one-way flow of blood through it in order to supply the entire body. The pulmonary veins return blood to the left atrium, and once the left atrium is full, blood flows through the AV valve, also known as the mitral valve, and then into the left ventricle, which then increases in pressure as it squeezes on the blood that it contains. Eventually, the force builds to the point where it can force the blood through the aortic semilunar valve and at the same time cause the bicuspid valve to shut, and this is what propels the blood to the rest of the body. The blood is ejected during a part of the heart cycle known as systole, or the contraction phase, and after blood is ejected from the ventricles, the heart enters a resting period known as diastole, during which the chambers fill with blood. Both atria fill at the same time, and both ventricles fill at the same time, and both ventricles eject blood at the same time when the heart contracts. The heart has to contract in a certain way to make sure that all the blood is squeezed out during each of these.
The cardiac cycle continues when the atria contract, forcing blood into the relaxed ventricles. Valves prevent the backflow of blood from the ventricles to the atria. The cardiac cycle begins when blood fills the atria. The right atrium is filled by veins that carry deoxygenated blood from the body, and the left atrium is filled by the pulmonary veins which carry oxygenated blood from the lungs. The atria are now filled with blood, while the ventricles are relaxed. Some blood flows passively from the atria to the ventricles at this time. The four chambers of the heart alternate between contraction and relaxation in a concerted fashion. This pattern is called the cardiac cycle. During the cardiac cycle, the heart chambers beat cyclically to enable a coordinated flow of blood.
Contractions. And so what we've got here is a quick heart animation. And so let's take a listen. Okay. Contraction begins at the apex and travels upward. There is a valve located at the exit to each chamber because the circulatory system is pressurized and the valves prevent any backward flow of blood. The atrial walls are much thinner than the ventricular walls. If you were to actually see an intact heart, you would be amazed at how much more insubstantial the atria are than the ventricles. They look like simply a pair of flaps of tissue on the outside surface of the heart compared to the size and strength of the ventricular chambers. Higher pressures are generated in the ventricles in order to move blood around the body. The walls of the left ventricle are the thickest because they have to pump against the most resistance, and that's due to the fact that as the systemic veins branch and carry blood to all different parts of the body, as blood moves through them, that increases drag because of the contact between the fluid in the vessels and the vessel walls. And so the greater the drag, the greater the back force, and as a result, in order to overcome that and actually move the blood around, the heart has to use quite a bit of physical force, and that's what accounts for the thickness of the left ventricular walls. The portion of the newly oxygen-enriched blood leaving the heart is diverted from the aorta by the right and left coronary arteries, which continuously split into smaller branches, forming a web of interconnections known as anastomoses, in order to consistently supply the heart muscle with a lot of blood. Regular aerobic exercise increases the density of these blood vessels. A portion of the newly oxygen-enriched blood also enters the right coronary artery and provides blood for the right ventricle and the posterior portion of the interventricular septum and the inferior parts of the heart. The left coronary artery provides blood to the left lateral and anterior walls of the ventricle and portions of the right ventricle and interventricular septum. And here you can see the coronary circulation. You can see some of the major vessels. So if we look here, what I want you to notice about this diagram is that the red vessels are going to be the coronary arteries and the blue vessels are the coronary veins. The circulation to the heart muscle itself is part of the systemic circulation. And if you recall, in the systemic circulation, the arteries carry the oxygenated blood and the veins carry the deoxygenated blood. And so take note of these different portions of the arterial circulation, front and back. Okay, occasionally the heart will stop pumping. Heart failure used to be called congestive heart failure, and this is when the heart can't move the blood effectively. It can affect either side of the heart. The pumping action of the heart can't overcome the resistance in the vessels, and blood backs up into the veins, and this increased pressure allows fluid to leak from the vessels and into tissue. In the left-sided heart failure, the right heart is pumping normally, but the left side can't keep up, and so what happens is that blood backs up in the lungs, and as a result, fluid leaks out into the lung tissue, and this results in pulmonary edema. Think about it kind of like putting a dam in a river. Remember that when you dam up flowing fluid, behind that obstruction, fluid's going to build up. And in the body, that accumulation of fluid in the tissue is called tissue edema, and that usually results in either a perfusion of fluid or a distension of the tissue due to the steady collection of physiological fluid inside those compartments. Symptoms include shortness of breath, wet-sounding cough, and hypoxia, and it can be treated with meds. These are agents that increase the rate and force of heart contraction, and also can be treated with diuretics that dry you out. They rid the system of excess fluid. In cor pulmonale, the right side of the heart can't move blood effectively. And so what you see here is that you're going to have trouble moving blood around the periphery. The heart muscles are working harder than normal. The muscles on the right side hypertrophy, and this prevents efficient pumping. It occurs in 85% of patients with COPD. Remember that COPD stands for chronic obstructive pulmonary disease. What happens here is that the left side of the heart pumps blood normally, and the unhealthy right side can't keep up, and blood backs up into the systemic veins, and this causes hepatomegaly and splenomegaly, swollen ankles, feet, and hands, and distended neck veins. So basically peripheral edema. And here you can see a comparison between left and right-sided heart failure. In this portion of the diagram, what's happening is that we've got buildup of fluid in the lungs, and again, this is because the right side of the heart is doing its job, but the left side of the heart is unable to, and you've got the inverse situation here with the peripheral edema. Okay, so let's note here, okay, left-sided congestive heart failure, right-sided congestive heart failure, and the differences between the two. So right-sided congestive heart failure, peripheral edema, hepatomegaly, splenomegaly, and it's this side of the heart that can't keep up. And in left-sided congestive heart failure, you have a problem with effusion into the pulmonary compartment. Okay. MI, also known as heart attack, is caused by inadequate blood flow to the heart muscle. Ischemia is the definition of inadequate flow of blood to an area of the body, and it doesn't permanently damage the heart, but it results in chest pain. This chest pain is known as angina pectoris. It can be treated with nitroglycerin, which dilates the coronary blood vessels and improves flow. An infarct is tissue damage and death that results from completely blocked flow, and it can result from a blood clot in the coronary blood vessels, also known as coronary thrombosis, and can cause permanent damage to the heart if tissue death occurs because the cardiac muscle is again unable to repair itself. And you're going to find this as a recurring theme in most muscle tissue. It lacks the ability to regenerate, so the damage tends to be permanent. And when we say damage, we're talking about the death of muscle cells themselves. We're not talking about the type of damage that you do to muscle tissue, say as a result of exercise, where we simply tear a protein and we don't actually destroy the cellular structure itself. Okay, so signs and symptoms: chest pain or heaviness, pain in the left shoulder, arm, neck, or jaw. And this is called referred pain, and this is a phenomenon that happens in the body when the brain is confused as to the source of the pain that it's trying to interpret. Since pain coming from the heart impinges on the same portion of the spinal cord as pain coming from the left shoulder, arm, neck, or jaw, it's difficult for the brain to discriminate between an internal and an external pain. And so it gives the impression to the individual experiencing this phenomena that it's actually coming from the heart, or actually coming from the shoulder and the arm, when it's actually in fact coming from the viscera. And this is one of the diagnostic tests that clinicians use to try and determine if there is a problem with the functioning of the internal organs. They can use the referred pain map as sort of a guide, a thumbnail. Also, nausea and heartburn, generalized weakness and clammy and sweaty feelings, along with shortness of breath and dizziness, are commonly reported, and all this can lead to an increased level of anxiety. If a heart attack is suspected, call 911 immediately and take aspirin, which is an anticoagulant and can help keep blood flowing around the heart, and this minimizes damage. The reason for this is that you don't want the blood to spontaneously clot, producing an embolus that could get trapped in a capillary bed, and if that occurs in the brain, it can cause a stroke, and if it occurs in the heart, it can exacerbate this already pre-existing heart attack. Medical diagnosis can include measurements of enzymes and protein levels in the blood, and this happens when cardiac muscle tissues die. Arteriosclerosis is a thickening of the inner layer of the arteries, also used to be known as hardening of the arteries. And it occurs to all of us as we age. It involves vessels becoming less flexible or brittle as a result of the accumulation of these plaques on the inner wall. This increases the risk of rupture and the likelihood of high blood pressure, and it puts an extra super huge strain on capillary beds. And here you can see some of the buildup of these deposits on the inside of the vessels. And what I want you to notice here is that these are fatty deposits. They're referred to as plaque, and they build up on the inner linings of the vessels, and it's made mostly of cholesterol, and it can block blood flow. Any blood vessel is susceptible, but the aorta, coronary arteries, and cerebral arteries are particularly susceptible. And the risk factors include heredity, diabetes, diet, and lifestyle. And so here you can see the buildup of these deposits on the inner wall. In addition to this, it's possible with the increased blood pressure, you could knock some of this stuff free, and it could flow in the blood, producing yet again another embolus. This is just a diagram showing you coronary angioplasty, which is a procedure in which a balloon-tip catheter is threaded up to the large plaque, and when it's in proper position, we inflate the balloon and we squish the plaque to the side to increase blood flow, and this alleviates some of the immediate symptoms that result from the buildup of all this material inside the large vessels. So here you can see how they put the balloon in and they expand it, and this crushes the plaque against the walls, and now the blood can flow more easily. And you can also use a stent. These are wire devices that hold the blood vessel open after the angioplasty, and this prevents reocclusion of the blood vessel, provided obviously that you control what produced the plaque in the first place, and that usually means a change in diet and exercise habits. The cardiac muscle is autorhythmic, which means that it beats all on its own, it's usually in conjunction with signals that are received from hormones or from nerve impulses, but it can basically beat to its own drummer. Uncontrolled individual contractions wouldn't be efficient, and so we have specialized cardiac cells called conducting cells that create and distribute the electrical current that causes the controlled and directed contraction of the heart. These are called nodal or pacemaker cells, and they not only create the electrical impulse, but they create them at a regular interval. The nodal cells are connected to each other and to the conducting network, and they're split into two groups, the SA and the AV node. The SA node is in the right wall of the atrium, so it's in the upper right-hand corner of the heart, near the entrance of the superior vena cava, and it generates impulses at about 75 beats per minute. The AV node is located at the point where the atrium and ventricles come together, and it generates electrical impulses at a rate of about 50 beats per minute. This SA node sends an impulse to the AV node before the AV node can send the signal. However, the AV node acts as a backup if the SA node were to fail. This results in a slower heartbeat because the AV node fires fewer times per minute. So here you can see the conducting system of the heart. There's the SA node, the AV node. These are called the bundle branches, and these are called the Purkinje fibers. And so the signal basically spreads across these walls. Once it hits the AV node, it rockets down this interventricular septum to the apex of the heart, where it radiates up the walls of the ventricles, and then we start the whole cycle over again. Once this wave, this electrical wave, is spread across the tissue, the contraction follows shortly thereafter. So if you've ever been to a baseball or a football game and you've seen somebody start the wave, this is very similar to how the wave works, where you have one set of people in one section, they stand up and they wave, and then that's the cue for the people neighboring them to continue propagating the signal around the stadium. In this case, the person that starts the wave is the SA node, and then the depolarization propagates across the walls of the atria and then down the interventricular septum to the apex and up the walls of the ventricle, and then the squeezing follows after each of these particular cycles. So the heart rate is not always 70 to 80 beats per minute. While the SA node sets the heart rate at rest, other factors can change it. The ANS has a direct connection to the SA and the AV nodes as well as to the heart wall, so it sends these pieces of electrical tissue information about when and where to beat. The sympathetic division can release neurotransmitters that increase the rate and the force of contraction, and these are primarily epinephrine or adrenaline. And parasympathetic ANS impulses can use the vagus nerve as their method of delivery, and this decreases the pulse and force of contraction. Ions, hormones, and body temperature can also alter the heart rate, and epinephrine can increase it. And so none of these really are surprises when you think in terms of what the body needs depending on changing conditions and when it needs it. The movement of electrical impulses in the heart muscle is done by specialized conducting cells. Once the impulse is generated at the SA node, it travels to the AV, and then there's a small delay, and this lets the atria fill with blood, and this is prior to contraction. Once the charge hits the AV node, it travels through the AV bundle or bundle of His. And so we send the signal, and then we squeeze after the signal is passed by. So it's depolarization, squeeze, and then wait for the next signal when and wherever that happens. Movement of electrical impulses in the heart is done by the conducting cells. The impulse travels down the right and left bundle branch in the interventricular septum, and these branches spread across the inner surface of both ventricles. The impulse travels into the Purkinje cells to carry the impulses to the contractile muscle cells of the ventricles. Contractions begin at the apex, and waves of contraction smoothly continue up the ventricle, and it squeezes out most of the blood. Now, the pump never goes completely dry, and this allows it to remain a viable pumping entity. If it were to go completely dry, even for a moment, it would probably fail. And goes back to really the way a pump works. In order to be effective, the pump usually has to be primed, and that allows it then to continue the pumping action on the subsequent fluid that comes flowing through it. Arrhythmia is an abnormal rhythm due to abnormalities in the heart's electrical conducting system. There are different types. Flutter is a coordinated but rapid contraction of the heart chamber, and sometimes it can reach rates of 300 contractions a minute. And fibrillation is rapid, uncoordinated contraction of cardiac muscle cells. Heart block is a condition where electrical signaling between the atria and ventricles is delayed or completely blocked, and this results in atria and ventricles contracting out of sync with each other. So now we've got a little animation on VFib.
A healthy heart pumps regularly at various levels of exertion and coinciding heart rates. Cardiac arrest occurs when the heart stops pumping correctly. Chaotic electrical activity throughout the heart causes uncontrollable fluttering or ventricular fibrillation. The heart beats erratically, no longer pumping oxygen-rich blood around the body, which starts to shut down. Automated external defibrillators are designed to shock the heart back into its normal rhythm. Placing 2 monitoring electrodes on the chest, the AED measures the electrical activity of the heart, analyzes the cardiac rhythm, and determines whether a shock should be administered.
Okay, let's talk about blood. Blood is a fluid form of connective tissue. The amount in your body depends on size and sex. Normally you have 4 to 6 liters of blood, which is about 8% of your body weight. There are 3 functions to it: transportation, regulation, and protection. It transports oxygen from the lungs, nutrients from the digestive system, and fat cells, and hormones from the endocrine glands to the rest of the body. On the return trip, it carries CO2 and other waste products to the kidneys, lungs, and other organs for removal. And so these are our body's sewage treatment plant. It helps regulate a variety of levels in the body to help maintain homeostasis by ensuring pH levels and electrolyte values that are within physiological parameters. It also helps to regulate body temperature by absorbing heat generated by skeletal muscle, spreading it throughout the rest of the body, or releasing heat through the skin. Okay, what else does blood do for us? It can take in or give up more fluid to help regulate the fluid balance of the body, and it protects us from invasion and infection by pathogens and toxins, primarily through specialized white blood cells that produce magic bullets called antibodies that function to prevent infection. The major components are plasma and the formed elements. The plasma is basically the liquid component of blood. It's primarily protein, water, dissolved ions, and it makes up about a little over half the blood's volume. It's 90% water, 10% nutrients, salts, oxygen, hormones, and other regulatory substances. And the plasma proteins are an important group of dissolved substances that include albumin. This aids in keeping the correct amount of water in the blood, primarily through its osmotic activity. Fibrinogen is needed for blood clotting, and globulins involve antibodies for protection from infection. Those are the magic bullets I was referencing earlier. The formed elements include red blood cells, which carry oxygen, white blood cells or leukocytes, which are primarily our body's defense mechanisms, and these can be broken into different subgroups. There are basophils, eosinophils, lymphocytes, monocytes, and neutrophils, and they all have slightly different roles in the defense of the body. Thrombocytes or platelets are cells that are involved in the clotting cascade. Now, one thing to understand is that of these cells we've listed, the red blood cells and the thrombocytes have no nuclei. They're basically cytoplasmic membrane that encloses a cytoplasm that consists of proteins and the occasional little bit of protein assembly machinery, but there's no nucleus. There's no great potential for biosynthesis here. They're basically um, delivery vehicles for the proteins that they carry. The other formed elements, the white blood cells, all these listed here, they all have nuclei and they're capable of biosynthesis and of mitosis. And so this just shows you how we can break blood down. If we were to take blood out of your veins and spin it in a device called a centrifuge, which basically contains a rotor, which is something that can pivot on an axis like a wheel does, and it has slots in it for tubes. And what these tubes do is they rotate around a central axis at a high speed. What will happen is that the blood will separate into denser elements and less dense elements as you spin. The denser elements collect at the bottom of the tube and the less dense elements towards the top. And so here you can see the breakdown of the formed elements of blood listed here and the plasma elements of blood listed here. This is in your book 1212, and you can see what the breakdown is for each of those different components. But essentially you should have red and white blood cells, platelets, and a significant amount of plasma in healthy blood. The red blood cells are created by red bone marrow through a process called hematopoiesis. Because they lack a nucleus in order to reproduce themselves, they look kind of like a frisbee. They're biconcave discs, and they primarily transport oxygen in the body through the use of a pigment called hemoglobin, which contains an iron ion as a binding site. And on a lesser scale, it transports carbon dioxide from the cells to the lungs for removal. Leukocytes guard us from invasion and infection by pathogens, and there's several different flavors. They each originate from different areas. Polymorphonuclear granulocytes come from red bone marrow. Mononuclear cells come from lymphoid and myeloid tissue. And there's three types of polynuclear granulocytes. There's neutrophils, eosinophils, and basophils. And you might wonder, well, what's the big deal about granules? Okay, so they have granules. What does that help them do? What biological process does that facilitate? And what these granules contain are powerful anti-pathogen molecules, proteins that are designed to destroy the pathogen on contact. So one of the things that these cells do when they come into close proximity to a pathogen is that they'll degranulate, basically spray the pathogen with a shower of these powerful anti-pathogenic chemicals, and the result will be the death of the pathogen in most cases. Now, what about the mononuclear cells? Well, these guys are your phagocytes, so they gobble up the invader, similar to, if you've ever seen the movie The Blob, they will extrude a pseudopod and they'll enclose the pathogen in a vesicle, which will then fuse with a lysosome and be destroyed. And then the pieces are used as pieces of warning flare antigens that are presented on the surface of these cells in order to alert the rest of the immune system, the specific immunity, to the presence of a pathogen in the body. And it's the lymphocytes that are primarily responsible for this arm of specific immunity. The B lymphocytes and the T lymphocytes have an attack that is sculpted to only target a particular pathogen, and that pathogen only, as a result of the molecules it has on its surface. It's like a dog tag, an ID tag. And so it'll take those particular pathogens out either by immunoprecipitation or by using the complement cascade along with the inflammatory response to chemically inactivate these disease-causing organisms and to rid the body of disease. So that's the big deal about granulocytes and agranulocytes. You might also ask, well, why are they these different colors? Well, they're these different colors because they stain that way when you use a dye in a blood smear that's designed to highlight some of the smaller structures inside the cell. The basophils, the granules light up blue when they use basic dyes that have a blue color, and the eosinophils light up red because they take up a red dye called eosin. So this is one of the ways that we can do basically a blood count. Take a population survey of the types of cells circulating in the blood at any particular time. And this gives us an idea of the type of infection you've got and what the proper clinical approach should be to rid you of disease. So the neutrophils are the most aggressive in cases where bacteria attempt to destroy the tissue. They engage in phagocytosis, where they surround and ingest the invader, close him up in a vesicle, and blast him into 1,000 pieces using lysosomes to help. And as the infection occurs, your body produces higher than a normal number of neutrophils. Eosinophils combat parasitic infections, and they also rid the body of allergens. And basophils are involved with allergic reactions and inflammation. They're important because they secrete chemicals such as heparin, which keeps the blood from clotting as it runs through the vessels, and that allows us to avoid the production of an embolus, a traveling clot, which would be obviously something very deleterious, as it could lodge in a capillary bed, and the result could be your death if it occurs in the brain or in the heart. There are two types of mononuclear cells. Monocytes are found at higher than normal amounts when you have a chronic infection, and they destroy invaders through phagocytosis. Even though they may take longer to arrive on the scene than the neutrophils do, the numbers are greater and they destroy more bacteria. And then lymphocytes, which protect us from infection by using processes that produce antibodies. Those are the magic bullets again, which inhibit or directly attack invaders, and some directly attack invaders. Thrombocytes are also known as platelets. They are the smallest form elements and are responsible for the body's ability to clot. The platelets basically stick together and plug the hole in the blood vessel, and they can release serotonin, which causes smooth muscle constriction. This is called vascular spasm, which temporarily decreases blood flow and reduces loss through hemorrhage. A person needing a blood transfusion can't randomly select anyone off the street as a blood donor because of incompatibility with the antigens on the surfaces of the red blood cells. And so what we have to do is we have to type the blood in order to figure out whether or not you could accept blood from that particular donor. And the way we do that is through the use of blood typing kits that use antigen antibody reactions that cause the red blood cells to clump. And this is a process called agglutination. And if this occurs, this indicates that you would have a blood transfusion incompatibility if we were to use that blood type. And this is also the basis of the immune response. So this is one of the ways that we fight the bad guy, is by actually causing him to immunoprecipitate, and as a result, we're free of the pathogen because we've basically stuck him in the mud and he's unable to do anything else. Well, there's over 50 different antigen types. The main focus for the blood cells that we're going to look at are the A, the B, and the Rh antigens. Like I said, there's other antigens that are on the surfaces of these red blood cells, but they're not germane to blood typing. A represents a particular type of self-antigen found on the surfaces of red blood cells. The person may be born with type A blood, and as a result they won't have antibodies in their plasma that'll react to that. So these individuals would have antibodies against the other antigens that we're considering at this point, the B antigen, and if they've been exposed to the Rh antigen, they'll have antibodies against that as well. Type B red blood cells have type B self-antigens, and as a result, they have anti-A antibody in the plasma and would react to any blood cells that have that antigen on their surface. And so when we type blood, we have to be aware of this. AB individuals have A and B antigens on their red blood cells, and as a result, they contain antibodies against neither A nor B, and they are termed universal recipients. They can take blood from an O, an A, a B, or an AB individual. And type O individuals have no A or B antigens on the surfaces of their red blood cells, and as a result, they're termed universal donor. Now, the bad part of this, of course, for the AB individual is that they contain antibodies against both the A and the B antigen, and as a result, they can only get a transfusion from another O donor. And so this is just a chart showing you the different types of incompatibilities that can accrue if we don't properly type the donor blood. So what you're looking at here are the red blood cell antigens that are present in the individual of that specific type. And here we have the plasma antibodies that are present. And what you're looking at in these columns are whether or not we have an agglutination reaction. An agglutination reaction is indicated by the large red splotches, whereas unagglutinated blood remains as single red blood cells. And so what you can see here is that an individual who is type O up here is going to have antibodies against both A and B antigen. And so if they receive type O blood, there won't be any agglutination, whereas if they receive either A, B, or AB blood, they will clot those, well, they'll agglutinate those red blood cells, and that'll be a disaster for the recipient. A type A individual can receive blood from an O or an A individual, but not from a B or an AB individual, as indicated by the chart. And then a type B individual, shown here in the second to last row, can receive blood from a B individual or an AB individual. I'm sorry, strike that. An O individual or a type B individual, and they cannot receive blood from an A individual or an AB individual. And as a result, they have a limited population from which they can receive donor blood. And then we have the AB individual who's a universal recipient and exhibits no agglutination in any transfusion scenario. Now you might think, well, gee, what about the donor's antibodies? Won't they react with the recipient's red blood cells in the case of some of these transfusions? And that would be true. However, in most modern facilities where they collect blood for transfusion to use it in surgical procedures or out on the battlefield or in emergency situations, they tend to remove the plasma component of the blood and resuspend it in physiological saline, and this reduces the number of donor antibodies to a minimal amount, and as a result you don't have to worry about the donor antibodies and the recipient antigen because the antibodies are taken out of the equation. So that answers that question. There are special antigens that are found in the blood of rhesus monkeys, and these antigens are called Rh factors, and it was the exposure of this antigen to human blood that first elicited the anti-Rh antibody in human beings. If an individual has this antigen, they're said to be Rh positive, and they won't possess an antibody against their own antigen, so they won't have that antibody in their plasma. However, if an individual is Rh negative, they will have Rh positive, they will have anti-Rh antibody if they've been exposed to the Rh antigen through some other process. Now you might ask, well, what processes would those be? Well, childbirth would be one, mismatched transfusion would be another. So there's any number of possibilities there, and what happens in between the first and the second exposure is that the individual will mount a significant number of antibodies against that antigen, and it's the second exposure that will result in a significant agglutination reaction should that take place. Now, as a result of this other antigen that lies outside the ABO group, we classify blood as positive or negative, and a lot of people get confused. For instance, when I say somebody is A positive or A negative, they think that that's referring to the ABO antigen, and it isn't. It's actually referring to the Rh antigen. So, for instance, somebody who's A negative would have the A antigen, but they would not have the Rh antigen. Somebody who's A positive would have the A antigen and would also have the Rh antigen. So that's where that terminology comes from. That's where the plus or the minus, positive or negative designation comes from. And another area where this becomes significant is when an Rh positive father and an Rh negative mother have a child. There's the distinct possibility that, especially if you just pick randomly amongst the population, you'll probably end up with a father, if he's Rh positive, who will have one gene that will code for the Rh antigen and one gene that will not. So he'll be what's called heterozygous. So he has a 50% shot, if he marries an Rh negative mother, to produce a child that is Rh positive. Now, this isn't a problem during the first pregnancy, because at childbirth the mother will be exposed to the baby's blood as a result of the rupture of the placenta and the umbilical cord. But it's the second pregnancy, which will happen after a period of time during which the mother can generate antibodies against the Rh antigen, that can present a significant problem for the second Rh positive baby, because it so happens that the antibody produced against the Rh antigen is small enough to cross the placenta and enter the developing baby's bloodstream. And at that point, it can cause lysis of the baby's red blood cells and produce a condition called erythroblastosis fetalis that can be extremely deleterious, if not fatal, if not treated immediately. So in the old days, the way we avoided this was we had blood tests, and if somebody had an Rh incompatibility, and it was the male who was positive and the mother who was negative, what we would do is we'd give them several options. One was you can refuse to have children, you can adopt, or you can not get married. These days, we don't have to worry about that because we have a product that will mask the Rh antigen for Rh negative mothers that have an Rh positive baby, and as a result, the immune system will never generate antibodies against that particular antigen. And that product is called Rogam. Don't confuse this with Rogaine, which grows hair on bald men's heads. This is Rogam, which masks the Rh antigen and allows an Rh negative mother to have as many Rh positive babies as she wishes. Okay. Anemia is a decrease in the number of red cells or an abnormal or deficient amount of hemoglobin. Possible causes include bone marrow dysfunction, low level of iron or vitamins, or improper formation of red cells. Common symptoms include pale skin, mucous membranes and nail beds, fatigue and muscle weakness, shortness of breath, and chest pain. Now, think about why this might be for a minute. I'll give you a few seconds. Okay, did you cogitate over why these symptoms might present? Well, let's think about the pale skin. The pale skin indicates a lack of red blood cells in the skin. Well, we would assume that that would be the case if red blood cell production were globally reduced, which it is in anemia. Same with the mucous membranes and the nail beds. How about the fatigue and the muscle weakness? Essentially, that comes from a lack of ATP. Remember that oxygen is needed for cellular respiration to generate the requisite 38 ATP per glucose, and if the oxygen isn't around, we have to go into anaerobic respiration, and that results in basically a lack of energy, and this would account for the fatigue in individuals who are anemic. There's a special kind of anemia called sickle cell anemia that we'll address here in this video. Okay, leukemia is essentially white blood cell cancer. This is a condition where a higher than number normal of blood cells are produced due to bone marrow cancer, and these white cells are immature and they're not good at doing their job. They basically gum up the works for the mature white cells that are capable of fighting infection. Leukocytosis is characterized by high white count, but this is usually due to infection, and leukopenia is a result of low white count and may be the result of drugs or chronic infection. All right, let's talk a little bit about the vessels through which the blood travels. Blood leaves the heart, specifically the left ventricle of the heart, through the aorta, which branches into large vessels called arteries, which split into smaller and smaller vessels, the smallest of which are arterioles, which then feed into capillary beds that perfuse the body's tissues, and this lets oxygen be dropped off so that the cells can use it for cellular respiration, while it picks up CO2, which is a waste product of oxidative metabolism, so that it can be removed. And this allows us to maintain fluid homeostasis, pH homeostasis, and it also provides the life-giving oxygen necessary to generate sufficient ATP to remain alive. Blood continues the journey from capillaries to small vessels called venules, which combine into veins, which eventually combine into the great veins, which empty back into the heart. For most blood vessels, walls are composed of 3 layers. These are called tunics, and there's 3 of them: the media, the interna, and the externa. We'll talk about what each one of them do. The interna is the innermost layer, and it's a loosely organized tissue made up of squamous epithelial cells. The compacting of these cells makes the surface smooth so blood easily passes through. We want that. We don't want the platelets to burst and initiate blood clotting spontaneously. And this is one of the reasons why the endothelium is basically a very slick surface. The tunica externa is the outermost layer, and it's mostly made up of fibrous tissue, and it provides the vessel support and protection, while the media is the middle layer and contains smooth muscle and also connective tissue in the form of collagen and elastin. And the muscle allows the diameter of the vessels to change depending on the body's need to route blood in greater quantities to different parts of the body depending on changes in physiological stress. So when we vasodilate, what we do is we perfuse the downstream area with life-giving blood, and when we vasoconstrict, what happens is that we reduce the blood flow to that particular area. And this is a very powerful way of controlling flow in the arterial circulation. The sympathetic nervous system determines the body's needs, and it controls the blood vessel diameter in order to control the blood supply as needed. And so here you can see some of these vessels and their capillary connections. Notice the difference between an artery and a vein. There's a structural difference. The artery has a more extensive tunica media and lacks valves, whereas the veins have a much less extensive tunica media and they contain valves. And these valves serve as a way of ensuring unidirectional flow of blood from the venous system back to the heart. And it's the collapse of these vessels, these veins, these flaps, that produces a condition called varicose veins, which, while unsightly, is also dangerous because it can result in spontaneous clotting of blood, which can produce an embolus that will travel and lodge in a capillary bed. And if this occurs in the heart, it can cause a myocardial infarction. And if it occurs in the brain, it can cause a stroke. So here's a little look at how the heart does its job and a little look at its outside anatomy.
The heart is a hollow muscular organ, cone-shaped and roughly the size of a fist. It is located in the chest, behind the sternum, and between the lungs. The heart sits slightly off-center. The heart consists of 4 hollow chambers. The 2 upper chambers are called atria, and the 2 lower chambers are the ventricles. The right atrium receives blood from distal parts of the body by way of the superior or inferior vena cava. To keep all the blood flowing in the same direction, the heart has a system of one-way valves. All of the valves consist of leaflets that open and close in response to changing pressures within the chambers. Then blood passes through the tricuspid valve to the right ventricle. The right ventricle pumps the blood out of the pulmonic valve to the pulmonary artery and on to the lungs for a new supply of oxygen. Oxygenated blood returns via the pulmonary vein to the left atrium, and from the left atrium it passes through the mitral valve and into the left ventricle. When the left ventricle contracts, the oxygenated blood is ejected through the aortic valve to the aorta and distal body tissues. The walls of the left ventricle are 3 times thicker than those of the right side because it takes more pressure to reach distal parts of the body. The septum effectively divides the heart into right and left sides to form 2 separate pumps. The 2 pumps of the right and left heart function in close syncopation. This is a closed system, so the blood continues to pump and flow in a continuous cycle.
Okay, the differences in the structure of blood vessels varies depending on the job that they do. The arteries, as we've already said, are thicker than veins because their tunica media is more extensive. They also have to deal with blood under a higher pressure because they're generally closer to the heart. The larger arteries have complete sheets of elastic tissue, lamina, and in their middle walls, a lot of smooth muscle tissue to deal with the increased pressure. The lumen in the veins is larger than the arteries, and it contains valves that prevent backward blood flow. And relaxation and contraction of skeletal muscle is what primarily serves as the motive force in the venous circulation. This is what increases what we call venous return to the heart. And so here you can see sort of a diagram how we take blood pressure, and this is a device called a sphygmomanometer, and it's something that you don't see much anymore, at least in this form, because now we use these automated devices to generate blood pressure. But in the old days, which weren't that long ago, the doctor would do is put a blood pressure cuff, which is an inflatable cuff, around the upper arm, the brachial region, and then he would inflate the cuff using this bulb and listen with his stethoscope, this is the head of the stethoscope, for a cessation of blood flow. It's basically a whooshing sound, and when the whooshing sound stops, he knows that he has sufficient pressure in the cuff to restrict flow through those particular arteries. And then what he'd do is release the pressure on the cuff until he hears a periodic whooshing sound. And that pressure that he records is the systolic pressure. And that's the pressure generated in the circulatory system when the ventricles are squeezing, when they're contracting. He'd continue to release the pressure in that cuff until the whooshing sound becomes a uniform sound. And that point is called the diastolic pressure. And that's the pressure in the circulatory system when the ventricles are relaxed and not squeezing. And so you can see here how we go through this process. And blood pressure is always recorded as systolic over diastolic. And if your blood pressure is consistently high under a series of activity regimens and over a period of several days to weeks, and we conclude that you have persistent hypertension. And at that point, what we'd have to do is look at the underlying cause for this condition, because it's not good to have blood pressure above normal for an extended period due to the fact that it could burst capillary beds and cause a stroke or a heart attack, or in the case of individuals with arteriosclerosis, it could knock pieces of plaque free, produce an embolus that could also result in a heart attack or a stroke. Okay, the capillaries are the tiniest of the vessels. They're only one cell layer thick. They have a tunica interna and a diameter of 8/1000ths of a millimeter. This is about the width of a single red blood cell. It's very, very tiny. This allows easy movement of oxygen and nutrients through the wall, while carbon dioxide and waste can move easily into the blood. Each cell requires about 250 milliliters of oxygen, producing about 200 milliliters of carbon dioxide every minute when the body's at rest. And it's these capillaries that are the area of primary exchange of oxygen for CO2 in the systemic circulation. There are two types of blood vessels in the capillary beds. A vascular shunt is the main road connecting an arteriole to a venule, and true capillaries, which allow the actual exchange of oxygen for CO2. True capillaries can be considered the on and off ramps for a vascular shunt. Precapillary sphincters are composed of smooth muscle, and they act as gatekeepers. They will allow the blood either to flow into the bed, or they'll redirect the blood around the bed if the body deems that it's not necessary to perfuse that area of tissue at that particular time. And again, it's smooth muscle that allows this to happen. The blood that's allowed through travels through true capillaries and then to the cells. Otherwise, the blood travels through the vascular shunt. And here you can see this system in action. So this would be with the precapillary sphincters open, and this would be with the precapillary sphincter shut. And so we shunt the blood directly into the venule and back into the venous circulation. Now, this has a cost, and because the system is designed for optimal gas exchange, it also is designed for maximum stress on the red blood cells that move through these vessels. Because of the fact they have extensive contact with the capillary walls, this wears away at the structural components of the red blood cell membranes, causes them to break down. And because there's no nucleus in human red blood cells, they're good for about 2.5 trips around the circulatory system before they have to be recycled by the spleen and then remanufactured in the bone marrow. So there's pluses and minuses with every system. The cardiovascular system is closed and pressurized, and if we break it, then we would hemorrhage. Okay, if you couldn't stop these breaks, you'd lose a large amount of blood and you'd die relatively quickly. But there are several mechanisms that allow us to stop massive hemorrhaging. Hemostasis is the stoppage of blood loss and is accomplished through a chain of events. First is clotting, where the inner wall of the vessel, due to damage, causes platelets to attach to the injured tissue and release their clotting factors, and this begins to initiate the clotting cascade. This also creates a structure called a platelet plug that slows blood loss, and they also secrete serotonin, which causes the vessels to spasm, and this further decreases blood flow to the area and accelerates the clotting cascade. Within 15 seconds, blood clotting usually begins. With the help of calcium ions and 11 different proteins, a chain reaction begins. One of the clotting proteins is called prothrombin, which is made by the liver with the help of vitamin K and is converted to thrombin, which transforms fibrinogen, which is also in the plasma, into a hair-like structural protein called fibrin, which serves as the backbone of the clot. The fibrin forms a net-like patch at the site of the injury, and it snags blood vessels and platelets, and within 5 minutes you got a clot. Once it's formed, it begins to retract. It pulls the edges of the damaged tissue together and allows them to regenerate, and so we're then in the process of wound healing. Eventually the clot dissolves over time when we don't need it anymore, and here you can see the process of injury and clotting. So here would be right after the injury, and what you can see here are the platelets here in blue and the red blood cells in red. And after the clotting cascade proceeds, as shown here, it's a very simplified diagram, we generate now this net that catches all these platelets, which in turn secrete clotting factors, which accelerate the clotting, and eventually then we stop the blood loss. Now, you might well ask, what would happen if we were to take one of these components out of the plasma, one of these clotting proteins, or if we were to lose calcium for some reason? Well, can you guess? I'll give you a few seconds. And the answer is you'd continue to bleed. And there are genetic conditions that actually result in just this kind of biochemical lesion, and they're called hemophilia. And hemophilia comes in many flavors. Some forms are sex-linked, others are not, and they all end up with a reduced ability to clot and stanch hemorrhaging. So this is an inherited disease. You can also have formation of unwanted clots, and this is thrombus formation, where a rough surface on the blood vessel can cause spontaneous clotting to begin because the platelets will snag. In a coronary artery, it can partially or totally block blood flow to the heart. This can produce a heart attack or an MI. The area of the myocardium affected determines the severity of the attack. And you might think, well, okay, so the heart is deprived of blood for a little bit. Once we restore blood flow, can't we then recover? And the answer, unfortunately, is no, because heart muscle tissue, unfortunately, does not regenerate and repair. And you might think, well, that's a lousy design, and you'd be right. I mean, it is a lousy design. It would be nice if it was capable of fixing damage, but it's not. And so the result of that is that the heart is permanently weakened after an event like that. So that's why people who've had one heart attack have to be extremely careful not to have another. They're at risk. An embolus is a traveling clot. It can be formed when a piece of the thrombus breaks off and travels through the circulatory system. It can eventually get stuck in small vessels, which can partially or completely block the vessel and affect its flow. A cerebral embolus could cause a stroke, and a pulmonary embolus can affect oxygenation. What are some risk factors for this? Slow flow of blood. You can see these in bedridden individuals, in people that sit and stand for long periods of time, in a plane, car, or bus. Women who smoke or use oral contraceptives are also at increased risk, and people on certain types of chemotherapy. The treatments and prevention for abnormal clot formation are aspirin and heparin, which can be taken to decrease the risk of clot formation. And streptokinase can be used as a clot-busting drug that can break up an existing clot. And now I'll tell you a little interesting story. You've probably heard of a product called Decon, and it's basically rat poison. And it works by the same method as heparin does. It causes the blood to not clot effectively because of ingestion of this anti-clotting drug. So what happens in these rats and mice that eat the Decon is that they do what rats and mice do, which is they fight with each other, they claw, they punch, they scratch, and they bleed to death after they've left the walls of your house. And that's the idea behind the rat poison, is that they don't die in the wall, because there they would stink to high heaven. And this is one of the reasons that they warn people that use this product, keep it away from your dogs and cats and your children, because it has the same effect on their circulation as it does on the circulation of a mouse or a rat. An aneurysm is a localized weak area in a blood vessel. It can be caused by a congenital defect, disease, or an injury. It's often asymptomatic, but it can rupture, and this can cause internal hemorrhaging. If it's a major artery, the individual can bleed out in a matter of minutes. Usually surgical intervention can fix the situation if you detect it quickly. There's also peripheral ischemia and gangrene. Ischemia is basically loss of blood flow to the area. If plaque affects smaller arteries, blood flow to the toes and feet may be inadequate, and it can lead to difficulty in healing, gangrene infection, and tissue necrosis. Now you might ask, well, before we get to the point where you have to amputate the limb, why doesn't the individual become aware of this infection and treat it? And the answer is because they're not getting the pain signal back to the brain. And the reason for that is that the ischemia also kills the nerve cells that produce the pain signal and send it back to the central nervous system and to the brain. So you're not aware of the fact that you've got this massive infection. You don't feel the pain. So this is a problem. This is where, when we talked about the chapter on the integumentary system, pain is your friend. Remember that pain is your body's warning signal to treat an injury that, if left untreated, could eventually cause disease and death. And so this is another example of where this can happen. Okay, there's also prolapses of these valves that permit one-way flow of blood through the circulatory system. There's a lot of different possibilities for the cause. There are connective tissue diseases, and sometimes coronary artery disease can contribute. Signs and symptoms, it can sometimes be asymptomatic, but you can hear murmur, fatigue, palpitations, dyspnea, this is labored breathing, and an increased chance for clot development. Diagnosis includes osculation, that's listening to the heart and trying to figure out what the sounds are telling you. Echocardiography, radiology, and cardiac cath, as well as stress testing. The treatment in meds and possible valve reconstruction or replacement if it's severe. And here you can see the pulse points of the human body. And you might think, well, gee, I kind of knew about a few of these. You knew about the antebrachial region, the popliteal region behind the knee, the radial region, and the carotid regions and the temporal regions, and maybe a few of you knew about the top of the foot, the dorsalis region. What do all these regions have in common? Why are they so special? Well, they're the few areas in the body where the arteries are actually close to the surface, and as a result you can pick up the pulse relatively easily. Remember that there's very little pressure in the veins, and so you can't get a pulse from feeling a vein because there's not enough pressure differential in the peripheral circulation to feel that. Whereas in the arteries, the blood's under much higher pressure, and the pressure differentials as the ventricles squeeze and relax are much greater. You can feel them with your hand. And so this is where these pulse points come in handy. In general, though, if you look at the organization of the human body, what you find is that the arteries tend to be deeper than the veins. Not by a huge amount, but by enough. And again, that's another clever design feature. Remember that the blood in the arteries is under high pressure, contains a lot of oxygen, and is very valuable to the body. And if you've ever seen an artery nicked, you'll never forget it because the blood comes out in spurts and can sometimes hit the ceiling. So it's pretty unforgettable experience. Whereas if you normally when you cut yourself, what you sever is a vein, and the blood in the veins is under low pressure, it contains very little oxygen, and as a result, it's much more likely to clot effectively, and you're much less likely to lose a large amount of blood because of the low pressure in those vessels. And so the evolution of the body is very clever in that we tried to bury the arteries deep and the veins more superficially. So a very nice design. Here's a little bit on angina.
Angina pectoris means, literally, a pain in the chest. Coronary artery disease has narrowed the arteries that supply the heart. During times of exertion or stress, the heart works harder. The portion of the myocardium supplied by the narrowed artery becomes starved for oxygen. When the myocardium is deprived of oxygen, chest pain, angina pectoris, is the result. Nitroglycerin is a medication that dilates the blood vessels. Nitroglycerin is available in tablets that are placed under the patient's tongue to dissolve. It is also available in sprays and patches. Patients are often instructed by their physicians to take up to 3 doses of nitroglycerin over 10 minutes when chest pain occurs. This results in more blood staying in the veins of the body, so there is less blood coming back to the heart. With less blood to pump out, the heart does not have to work as hard. If there is no relief of symptoms after that time, patients are advised to call 911 if they continue to have pain despite the nitroglycerin.
Okay, arteriosclerosis is also termed hardening of the arteries, and it comes about as a result of age. Materials get deposited in the inner walls of the arteries or other degenerative conditions. Signs and symptoms, there's often none for many years, and then you have increased blood pressure, angina, and transient ischemic attacks. These are called mini strokes or TIAs. The diagnosis is angiogram, blood test, and stress test, along with MRI and ultrasound. The treatment is improved diet and exercise, smoking cessation, stress reduction, balloon angioplasty, and surgical repair. And so here's a little bit on coronary artery disease. Okay, embolism. It's caused by thrombophlebitis, venous stasis, inflammation, smoking, hypercoagulation disorders, contraceptives, varicose veins, foreign particles, trauma, tumor, and pregnancy. All of these can trigger spontaneous clotting. Dangerous thing. So what do we do about it? Signs and symptoms depend upon the location, size, and the number of emboli. The diagnostic tests are perfusion scans, and the treatment are clot-busting meds. Preventative measures can include anticoagulants, physical activity to get the blood moving, treatment thrombophlebitis, smoking cessation, and surgical removal of the embolus, of the blocked embolus. Hypertension caused by heredity, diet, age, obesity, smoking, stress, and the decreasing flexibility of the blood vessels. Signs and symptoms are often not noticed until a heart attack or stroke happens. It's easily determined with blood pressure cuff, increased mass of the left ventricle, ringing in the ears, not feeling right, or being agitated and having a short temper. Diagnosis is blood pressure cuff measurement. The treatment are changes in diet, weight loss, exercise regimen, relaxation techniques, decreased alcohol intake, smoking cessation, meds that primarily are diuretics, so they cause you to lose water and as a result reduce blood volume, which in turn reduces blood pressure, or a combination of any of these. MI is caused by situations that lead to decreased blood flow to the heart, which can lead to ischemia and necrosis. Signs and symptoms: indigestion with a heavy crushing, squeezing discomfort or pain in the center of the chest, radiating pain to the left shoulder or arm, or to the jaw, or even in the shoulder blades, followed by anxiety, inability to sleep, dyspnea, nausea and vomiting, or sweating. Now you might think, well, why pain in the left shoulder or arm or in the jaw or by the shoulder blades? That's nowhere near the heart. Well, the answer to that is a phenomenon called referred pain. And referred pain is a kind of an unusual bodily response. And it's characterized by surface pain, pain on the body's surface, it doesn't originate from an injury in that area, but instead is the result of the pain coming from an internal structure, such as an organ, which happens to impinge on the same area of the spinal cord as pain that does come from that region. And so the brain has a difficult time discriminating between the two, and it confuses pain in the arm with pain in the heart. And as a result, the classic picture of somebody having a heart attack is grabbing that left arm and falling to the ground. And it's not because the arm hurts, it's because the heart hurts. So here's a little bit on heart attack. Okay, varicose veins are dilated and distorted blood veins that are normally found superficially in the legs but can be found in rectal areas such as in hemorrhoids, or caused by excessive blood pressure. Contributing factors are heredity, obesity, and sitting or standing still for long periods of time, along with pregnancy. Signs and symptoms vary in severity from none to extreme. It can include night cramps, dull aching pain in the feet and ankles, fatigue, pain, itching, and even bleeding for hemorrhoids. And people sometimes laugh at hemorrhoids. Ha ha ha, aren't they funny? Well, yes and no. The funny part is, yes, they can be discomforting, and because of their location, they can be a cause for some poorly conceived humor, but they're dangerous because of where they're located. If they bleed, because of their location, they're very close to a high population of bacteria. And if bacteria get into the blood, they can produce sepsis, which can produce multiple organ failure. And so that's the reason they need to be considered seriously and treated as soon as possible. Diagnosis includes a physical exam, and the treatment is weight loss, movement to prevent venous stasis, support hose, elevation of the legs, surgery, usage of laser sclerotherapy, stool softeners, and surgery for hemorrhoids. Bradycardia is a slow heart rate. It can be caused by heart damage, increased vagal stimulation, and also certain drugs can produce it, but sometimes it's idiopathic, meaning we don't know what causes it. Signs and symptoms are a slower than normal heart rate, usually less than 60 beats a minute or less than 50 beats a minute at rest, during sleep, or during lethargic stages. Again, basically a low activity level and difficulty in engaging in physical activity of any type of exertion. Basically, you don't have enough blood getting to the body quick enough to allow the body to produce enough ATP to keep you going. The diagnostic tests are ECG, and the treatment is a possible pacemaker, which is an artificial device that will help regulate the heart rate. Tachycardia is the opposite. It's a rapid heart rate. It can be a response to a decrease in oxygen in the tissues. It can be the result of stress or physical demands or heart disease, but it can also be idiopathic or congenital. Signs and symptoms are a rapid heart rate, usually greater than 100 beats a minute, in the absence of exercise. Diagnostic test is ECG, and the treatment are meds. Certain types can respond to carotid massage, cardioversion, or vagal maneuvers. Anemia can be caused by cancer, radiation, or chemotherapy that alters bone marrow activity, a lack of certain amino acids, a lack of folate, a lack of iron or B6 or B12 in the diet, production of defective red blood cells, or excessive blood loss. Signs and symptoms include pallor, fatigue, tissue hypoxia, that's lack of oxygen, muscle weakness, shortness of breath, palpitations, and angina. Diagnostic tests include blood test, history, and physical, and the treatment is to treat the condition that creates the anemia, stop the bleeding, for instance, replace the erythrocytes by transfusion, or fix dietary deficiencies. Hemophilia is an inability to clot, so you hemorrhage spontaneously. It can be inherited, although a third of the cases have no history. Signs and symptoms are bleeding episodes into the joints and the muscles. Pain often accompanies these episodes. Internal bleeding is always a possibility. Diagnosis includes blood tests, and the treatment includes infusion of clotting factor. Development of a synthetic clotting factor has been a very effective treatment regimen in recent years. We've been able to characterize accurately these different types of hemophilia and depending on which clotting factor is missing, we can artificially administer it and restore normal clotting function in many of these cases. Leukemia is white blood cell cancer, and sometimes it's idiopathic, but sometimes it can be inherited or can be caused by viral infection. Signs and symptoms include headache, fatigue, dyspnea, sore throat, fever, swollen lymph nodes, bleeding of the mucosal membranes of the mouth and the GI, bone or joint pain, enlarged lymph nodes, large liver or spleen, repeat infections, and anemia. By the way, there are terms for these. Enlarged liver is hepatomegaly, enlarged spleen, splenomegaly, and lymph node swelling is lymphedema. Okay, so keep an eye out for those in your medical terminology class. So here's a little bit on leukemia.
Leukemia is a cancer that usually affects the white blood cells. White blood cells develop from stem cells in the bone marrow. Leukemia results when something goes wrong with the process of maturation from stem cell to white blood cell. Usually, there is a rearrangement of pieces of chromosomes that disturb the normal control of cell division. The affected cells multiply without restraint, becoming cancerous and ultimately occupying the bone marrow, replacing the cells that produce normal blood cells. These cancer cells may also invade other organs, including the liver, spleen, lymph nodes, kidneys, and brain. There are 4 major types of leukemia. Acute lymphocytic leukemia is a life-threatening disease in which the cells that normally develop into lymphocytes become cancerous and rapidly replace normal cells in the bone marrow. It most often affects children between the ages of 3 and 5, but can also affect adolescents and adults. Acute myeloid leukemia is a life-threatening disease in which myelocytes become cancerous and rapidly replace normal cells in the bone marrow. Exposure to large doses of radiation and use of some cancer chemotherapy drugs increase the likelihood of developing acute myeloid leukemia. Chronic lymphocytic leukemia is characterized by a large number of cancerous mature lymphocytes and enlarged lymph nodes. Chronic myelocytic leukemia is a disease in which a cell in the bone marrow becomes cancerous and produces a large number of abnormal granulocytes, a type of white blood cell. This disease may affect people of any age.
Okay, what are some of the treatments for heart attack? Nitroglycerin dilates the coronary arteries and increases cardiac blood flow. Thrombolytics or clot busters. Anticoagulants can prevent clotting. Heparin and Coumadin are examples. Coumadin is actually what's in decon. Oxygen decreases the work of the heart, and drugs can improve heart function. There are also surgical interventions such as balloon cath and CABG. Blood pressure meds are used to control blood pressure, and they work in different ways. Possible mechanisms include decreasing blood volume. These are the diuretics. Vasodilators, such as ACE inhibitors, which stands for angiotensin-converting enzyme inhibitors. Remember that angiotensin is a major hormone in the increase of blood pressure. So when angiotensin is activated, blood pressure goes up. So if we reduce the rate at which angiotensin is activated, we can cause a reduction in blood pressure. We can also slow down the heart rate using beta blockers or calcium channel blockers. There are also cholesterol-lowering bloods that decrease total cholesterol and prevent blood vessel clogging. Examples include statin meds such as Zocor or Lipitor. And there are also meds that treat shock, which is characterized by low blood pressure and can interfere with tissue perfusion. Meds for shock stimulate the heart to increase the rate and force of contraction. Examples are epinephrine and dopamine. If blood loss is contributing to the low blood pressure, blood replacement or IV fluid is necessary. Incidentally, a little piece of helpful advice, first aid for somebody who is in shock is to lay them down and to elevate the feet. This allows the heart to overcome the force of gravity and increases perfusion to the brain. So just something to keep in mind. All right, that ends Chapter 12. Be sure and look over your lecture notes, and good luck on the final exam.